The data we're sharing today is from Tuesday, May the 31st to Monday, June the 6th, and it was posted yesterday online as usual. If you've looked at the numbers, you know that there's a lot of good news. I'm pleased to report that all the data, including our PCR positivity rate and wastewater surveillance, shows a continued trend of declining COVID transmission in the province. Between May 31st and June 6th, our average PCR test positivity rate was about 15%. That's a decrease of 2% from the previous week. As well, wastewater levels continue to trend down. They're down to or near the level before Omicron in many communities. The levels are higher in Edmonton and Calgary, and the levels fluctuate from day to day, but they continue to trend down. The result is that COVID admissions are down sharply. In fact, this is the lowest number of total hospitalizations we've seen since the peak in the initial Omicron wave, and the lowest number of ICU admissions we've seen since August. Overall, the wave of patients that's straining the system is beginning to ease. In the smaller regional centres, patient numbers and total occupancy are at or below the levels in the years before the pandemic. The numbers are still high in Edmonton and Calgary, with a few sites over 100% occupancy, but the levels are beginning to ease there as well. There should be relief for the staff in the coming weeks as the Omicron BA2 wave continues to recede. And once again, to all of our frontline healthcare workers, I'd like to say thank you. Now, 2 weeks ago, I said that available data seemed to indicate that the BA2 wave was nearly behind us. Today, we can see that we are past this wave and in a period of declining transmission. Barring the arrival of any new variant or sub-variant that behaves differently, we expect to see low transmission rates throughout the summer, especially as more activities move outside. I hope that every Albertan has the opportunity to get out and enjoy the splendor of our province this summer and the weeks ahead. As we said before, we expect COVID to become more of a seasonal occurrence with higher rates in the colder months, similar to the annual flu season.
COVID-19 is still present in our communities and can pose a risk to us, our loved ones, and our healthcare system if we let it. We only need to look at our data to see that there are still cases across the province, and while fewer by the day, there are still many Albertans who are seriously ill. I want to remind Albertans who have not yet been vaccinated or who have not received all doses they are eligible for that vaccines, without a doubt, continue to be our best protection. Currently, less than 50% of Albertans have received the third dose that they are eligible for. If it has been 5 months since your second dose and you're 12 years of age or older, I encourage you to get your third dose today. As we think about our plans for the coming months, we need to continue to reflect on the information available to us and make decisions based on our own personal context. This means considering wearing a mask at times when transmission is higher, or when gathering with loved ones who are at higher risk of severe outcomes. In addition, it will always remain vital that all of us remember to continue good habits that will serve us well as we continue to live with COVID and other infections, such as washing our hands regularly and avoiding being around others if we're sick.